Hi, thanks for joining me for another video from Counselor Tips. In this video, we're going to be covering some information about depression. It's important for people to understand the difference between feeling sad and actual depression. Feelings related to being depressed can be sadness, numbness, despair, helplessness, hopelessness, despondence, irritability, anger, guilt, shame, worthlessness. So although a variety of feelings can appear, assess a client to find out where they are and the combination of feelings that they're exactly having. There are a variety of thoughts clients can have that are a part of feeling depressed. Clients may think that they're not good enough. Clients can think that they're not lovable or likable. Clients may think that their situation or that they are hopeless. Clients may have thoughts that they're helpless or they've already tried to fix their problems and they're beyond help. Clients may appear to be pessimistic. Clients may demonstrate all or nothing thinking. Clients may be catastrophizing. Clients may be fixated or focused on the downside or worst case scenario. There's also a multitude of behaviors that can come along with a person feeling depressed. A person may appear to be withdrawn or isolate. A client may be disengaged from relationships or environments or situations. A client may appear agitated or frustrated. A client may appear lethargic or disinterested. A client may be presenting with poor concentration. A client may have behaviors of self-harm. A client may have behaviors that are leading towards suicidality. When you're working with a client who's presenting with depressive symptoms, it is imperative that you assess them. It's imperative that you note the instrument that you used for depression assessment, as well as the client's score. You want to note the client's specific thoughts, feelings, and behaviors that are related to their depressive episode. You want to investigate the duration across lifetime of the client's depressive episodes and whether they come and go or whether they're chronic and underlying. You want to be able to assess and report the client's current duration of depression. That means how long has it been going on? And you want to assess the client's lifetime experience with depression as well. It will be really important for you to investigate if the client has been assessed for their depression regarding medication management. Lastly, it's imperative that you look at their family of origins, history of depression as well. There could be a biological component as well as an environmental component related to the client's depression. So make sure that you do a thorough assessment prior to diagnosing or treating someone who is presenting with depression. Remember, while you are assessing a client's symptoms and history of depression, you're also going to be assessing their immediate needs and if there is the potentiality of crisis. If the client is in imminent danger of harming themselves by self-harming, being suicidal, becoming suicidal, or homicidal, then we must address this type of safety risk before we treat the depression. Part of treating depression is educating the client So using psychoeducation is very supportive to teaching clients some normalcy about feeling depressed. One of the goals is to normalize a client's feelings. Another goal would be to empower the client. And lastly, we also want to instill hope in the client. So the psychoeducation piece can be tremendously supportive for counselors to clients when working with someone who presents with depression. You want to provide some information about depression during your psychoeducational piece. So one is that everyone feels sad at some point. Sadness is an absolutely normal response when one feels loss or rejection or disappointment. A person feeling depressed is a normal response to one of these. And depression is not as uncommon as people like to think. Depression is an emotional response to a perceived problem in someone's life. Depression may come from something happening in someone's life that has created a situation of uncertainty, of fear, trouble, or disappointment. But depression can also be biological. So sometimes clients will present and they have a combination of the two. They'll have a situation that has occurred as well as the biological propensity for being depressed. So as a result, a client may be presenting with a significantly lower mood due to those two factors occurring at the same time. Part of our job in counseling is to help the client connect their thoughts, feelings, and behaviors to exactly what is happening in their life. A person presenting with depression isn't any different. We want to help the client investigate the thoughts that are taking up residency in their mind. And these thoughts are oftentimes driving the client's choices in their behaviors. If we help a client investigate what kind of thoughts they're having, such as if a client is ruminating on negative thoughts, then the result of this rumination of negative thoughts is more negative thoughts. Also, another result would be a paralytic type of response, meaning a client can't even respond to their own life or take care of basic tasks in self-care. If a person is feeling this poor that they continue to have a cycling of negative thoughts and behavior responses that are not positive, it creates a negative feedback loop. So if a person withdraws because they're having negative thoughts, which are creating negative behavior choices, the person may feel shameful and withdraw. If a person has this type of response, generally it is going to create more negative thoughts as a response and become a vicious, never-ending loop of negativity. Part of the goals in addressing someone with depression is to get them to start changing what they can, so they can be working on their negative thoughts with you in counseling, and you can teach them tools to help them get out of the negative thought loop. In the meantime, one thing you can help clients with is for the clients to start scheduling enjoyable activities that they can engage in right away in their life. If the client is engaged in activities that will promote positive thoughts and mood, this can help shift not only what they think and do, but also their feelings. If a client has presented and they have not been engaged in their life for a while, it will be really important that when you schedule things with a client, that you do small incremental steps to start with. It's not helpful for a client to schedule something every single day if they have done nothing for weeks or months. Try to teach them to be reasonable by picking one thing a week they can do to start reintroducing pleasant activities that can stimulate positive thoughts and mood. You think of creative activities that you would like to do with the client and personalize them to the client. That way they're meaningful. Another thing that can assist clients is working through problem solving. Support the client as they identify one problem in their life. Help them to be very specific about the problem. Assist the client in generating solutions, not implementing solutions yet, but generating as many solutions as they can to solving the problem. If we help a client to discover that they already have many tools to solve their own problems, and that these tools could be transferred to their current problem, clients seem to have more self-efficacy and confidence. While helping the client seek out solutions to solve their problem, help them distinguish between the pros and cons. And then when the client has generated all the solutions they can think of, help the client identify one solution that they want to try, and then see what happens. Assist the client in picking one solution they want to apply and getting them to commit to that one solution that they want to apply to their problem. Have them take home the list of solutions they have compiled so that they have alternative choices. If the one solution they've chosen hasn't worked, then they have a list of others to choose from. If you want to see more videos from Counselor Tips, please consider subscribing to this channel and turn on the bell. And do me a favor and share this video with a counselor that you think could benefit from it. See you soon.